Tonight, we're taking a look at COVID-19 misinformation. With plenty of conflicting claims circulating online, it's difficult to know what's true and what's not. Many of our viewers have sent in questions they have about COVID-19 claims, and to answer them, Sajjad Fazel is a public health researcher at the University of Calgary. He is looking into some of the information he's been seeing since the pandemic began, and he joins me now from Toronto. Sajjad, thank you for joining us.
Thank you for having me, Carole.
So a manager of a grocery store in Nelson, BC today had to hire security guards for the first time in the 40-plus years of his history of his grocery store to protect against anti-mask hostility. And he says about 20 to 30% of his customers refuse to wear a mask, and they become confrontational when asked to do so. Now, some people think it's about freedom. Some people think the mask doesn't work. And to be fair, early on, infectious disease specialists were on this show and others saying that a mask could even make it worse. So what is the best information about wearing masks that you have today?
Right. So it is an important question, and there seems to be some sort of confusion. Though public health agencies and public health professionals have been clear from the beginning that we know largely masks help someone stop spread COVID-19. So if I wear a mask, I'm protecting you. And if you wear a mask, you're protecting me. Now, new research shows that it even benefits the wearer of the mask and prevents them from getting COVID-19 to a certain extent. But it's majorly for preventing others being infected in case you have COVID-19 and are asymptomatic.
Okay. What are some of the questionable COVID-19 claims that you have been looking into?
So the recent one was regarding the Great Reset, and you see a lot of people say that this is planned so that everyone will start buying vaccines, or this is a plan to shut down the economy. But it doesn't benefit anyone, and most of those claims are baseless. It's somebody taking a few words and construing it and extrapolating it and exaggerating it. And this is why you see a lot of people fall prey to misinformation, because it's not all lies. They take something that is from the media, that is truth from a politician or from a friend, and then they just extrapolate it. I mean, they build a story around it that sort of attracts attention. And this is how most of the misinformation right now is spreading around vaccines and this whole COVID-19 pandemic being planned.
Give me an example of the truth around that combined with a lie to make it seem like the lie is part of the truth.
Right. So we do know that the Prime Minister said this is a time to reset the economy. Of course, what he was talking about was in terms of having a more sustainable economy. In terms of when I look at COVID-19 from a health perspective, I see that it has outlined major flaws in the health system, such as how we look at long-term care homes. And so for me, it's a time to say, look at what's going on in long-term care homes, and maybe wasn't it the limelight that things we need to take care of. Now, somebody takes that word, what the Prime Minister said, and then says, oh, this is world leaders coming together and making a planned pandemic, and there's a cabal of world leaders working together with Big Pharma, and they want to profit from this pandemic by making vaccines mandatory. And that is how one piece of news item or one thing that the Prime Minister has said is construed into a whole narrative that is totally false and baseless.
Yeah, and who's amplifying this? I mean, is it real people that have put it together, or is it bots?
Yeah, that's a very interesting question you raised. Actually, if you see, there's a lot of interference and bots from foreign countries. There's a lot of that going on. There's a lot of polarization, and not only in Canada, even in the United States especially. You see there's a lot of polarization with bots, but at the same time, there are certain individuals, politicians, celebrities, and even so-called scientists, those who don't rely on research, people who just make blatant claims, who are actually fueling conspiracy theories. And sometimes it's not fueling conspiracy theories outright, but using these words that cause polarization between people.
Okay, what do you make of the claims made by Dr. Roger Hodkinson? He's the CEO of Western Medical Assessments, that COVID-19 is the biggest hoax ever perpetrated on an unsuspecting public.
Yeah, that's an outright lie, and the claims that he has made, that and including others, they don't have any evidence to it. I mean, we do see people are dying, and saying that it's just like the flu was another false claim. I think we have to understand, and maybe this is something we are making very clear today here, Carole. It's not about who necessarily says something, but what the overwhelming body of science and evidence says. So the viewers and the general public shouldn't say, "Oh, Dr. Fazel said this," or "Dr. So-and-so said this." No, but rather, what do the public health agencies say? What do the public health units say? And what is the overall body of evidence? And that's why when we look at policies and we make public health policies, we don't look at one study. There could be some conflicting studies, but you're looking at what is the overall majority of the scientific evidence, and that's how we make policy.
All right, let's get to some viewer questions from Lynn tonight. I read a study that found that those who had the flu shot were more susceptible to the coronavirus infection. Is this something to be concerned about?
No. That's not something to be concerned about. It's a good question, though. So when you take the flu shot vaccine, you are not more susceptible to COVID-19. That's false. And in fact, we would advise people to take the flu shot now more than ever, because you are protecting yourself from one set of flu viruses. And I think it's something very important right now. There is no evidence that having a flu shot will increase your susceptibility towards being infected with COVID-19.
Okay, this next question is from Deanna. Studies have shown 70 to 100% of hospital admissions worldwide have been vitamin D deficient. Why are health authorities in Canada not suggesting the recommended 1,000 to 4,000 units of vitamin D at their briefings?
So first of all, I don't agree with that. 70 to 100% of patients who have been admitted due to COVID-19 do not have vitamin D deficiency, especially worldwide. No, that's not true. The second point now, yes, there are people who have vitamin D deficiency. Those who have had COVID-19, who have been infected, have vitamin D deficiency. Now, if you have vitamin D deficiency, should you take a supplement? Probably, yeah. Can you get supplement of vitamin D from a balanced diet? You also can. Why isn't it a public health recommendation that everyone should take 1,000 to 4,000 IUs? It's because there are side effects. And so if you don't have a deficiency, you could overdose with vitamin D and get those adverse effects.
Okay, this next question comes from Charles. Why does it seem to be safer to be outside without a mask when I would presume the wind could carry the virus farther than the normal 2 meters?
Right. So this is a very good question. So when we talk about this, we look at the risk and the risk ratio. When we say you should be 2 meters away, we look at the risk of being infected. It does not mean that if you are 3 meters away, you would not be infected with COVID-19. However, when we talk about being outdoors, we are looking at ventilation and how much virus load is there in the air at that particular point in time. And so we know that after a couple of minutes, sometimes up to 15 minutes, the virus does land on the ground and doesn't remain suspended in the air. And when you're outside, the ventilation helps to decrease the viral load, and so you're less likely to breathe in the virus. But again, it's not zero. The risk is still there.
Okay. What do you say in the final 50 seconds left? What do you say to those, Sajjad, who say this is overblown, that it's theater, that that it's not as serious as the flu or what people think it is, or people are saying it is?
Yeah, I would say reach out to those who are suffering from COVID-19. Reach out to those who have had a loved one dying of COVID-19. Reach out to those who have been infected with COVID-19, and listen to their stories, and you'd see the gravity of the situation we are in. It's not a cabal, it's not a hoax. We need to take things seriously. we do have pandemic fatigue, but we need to take things seriously. We need to be vigilant and follow public health precautions and hopefully get out of this as soon as possible.
Sajjad Fazel is a public health researcher at the University of Calgary. Sajjad, thank you for joining us once again tonight.
Thank you, Carole.